Thank you, Mr. Hutchinson. I appreciate it. Mr. Miller.
Senator Whitehouse, I appreciate the opportunity for myself and Covisint to be able to talk about the issues associated with e-prescribing. Although in the last few years Covisint has supported many doctors and pharmacies related to things like RIOs, and also supports the current law enforcement information sharing program, that was not our birth. The birth of Covisint was in the 2000, really based upon the automotive industry. And I'm really here to tell you that this problem of secure transaction sharing among large organizations that may not trust each other, where there is the capability for fraud, has been solved in other industries. This is not a brand new thing. This is not something that has never come up before. Covisint, in having to bear this problem in automotive, has found some techniques in order to do this. The automotives very early on realized that there was going to be a need to go to electronic transactions. A large automotive manufacturer does billions of transactions every month, and it's gotten to the point with global awareness, with global suppliers, that you just can't do that with paper. You can't put pieces of paper in an envelope and send it. So certainly in the 90s, they decided to go to an electronic means. In 2000, Covisint was started to leverage this new thing called the Internet to be able to make it more effective and cheaper, really, to be able to do this type of electronic transactions. These transactions moved to electronics, and I can tell you for a fact, having been in the automotive industry then, that there was a lot of issues associated with security of that type of thing. And here's what was found out. What was found out that electronic transactions have a few things that paper-based transactions just don't have. They have an easy auditability. So they are truly auditable because you can send them through some sort of centralized system. You can count them in the hundreds of millions. They're trackable in real time. So is it really effective to be able to find out that somebody is prescribing drugs that they weren't supposed to be prescribing 6 months after that event occurs, right? Real-time action is very important. They're transparent. And by transparent, I don't mean insecure, and I don't mean that HIPAA-based information is exposed. By transparent, what I mean is it is very difficult for two parties to collude and get around the system, as it is much easier in paper-based transactions. And then you can take a look at historical information. I would assume that there are hundreds and hundreds of millions of transactions on controlled substances. Can you see the types of things? Doctors and pharmacists who are probably getting around the system oftentimes use things that maybe aren't quite so obvious. But perhaps by looking at months and months worth of records or years worth of records, you can see trends that you wouldn't have been able to see. Automotive's been doing this for a long time to track quality issues associated with global suppliers. The other thing that I've found being a security expert is the fact that organizations oftentimes insist on picking the most complex, difficult, and most secure technology that is offered at that time. And really that problem becomes extremely difficult then to implement those technologies. Half implementation is almost worse than no implementation at all. As has been said here, if people go half one way and half the other, you're really not going to kind of get the adoption that you want. So it's really important that you find a simple and secure method for implementation of e-prescribing. Those types of methods are certainly found in other areas. Again, they're found in manufacturing and automotive, but they're certainly found in other areas also. For example, web banking that we do right now. The New York Stock Exchange does all of its transactions electronically, and they don't seem to be worried about the fact that people could steal trillions of dollars of information. So what are kind of the security methodologies, at least that we have seen work in an industry with large constituents that don't necessarily trust each other? The first thing is a secure authentication is extremely important. So something that authenticates the user. But you don't have to go to things like PKI. You don't have to go to things like issued smart cards. There are other authentication mechanisms. Again, I do web banking with an ID and a password, some additional questions. The world that does that, it seems to be good enough for the guidance from the FDIC, so I would assume it might be good enough for this. Also, the idea that there are identity providers that are already out there. Large hospital systems large pharmacy organizations that manage IDs today that can vouch for the identity of an individual. In addition, the implementation of some sort of trusted broker is definitely something that we've seen. If you have organizations that are working with each other, for example, a doctor who's working with a pharmacy, they could collude, and even in an electronic system, they could find a way that nobody might see that. If you put someone in the middle of the transaction, some type of independent party who kind of monitors it, it's much more difficult to collude between organizations. And then last off, you really need both policy and oversight that can be implemented in a consistent manner. Simplicity is the most important thing here. If it's not simple, it won't be adopted. So, in conclusion, I really think that the success of any system that we have is really about adoption. Adoption is the most important thing that we've seen in the automotive industry, that we've seen in healthcare industries in general, right? It has to be cost-effective and secure, and we certainly believe that any move towards an electronic system is much more superior to the paper-based system that we have. So I thank you for the opportunity to testify.
I thank you, Mr. Miller. In our research, my wonderful staff found testimony from Mr. Ratliff of your organization at a previous hearing, in which he said, "We have maintained the confidentiality and integrity of these transmissions, the e-prescribing transmissions, for the prescriptions that can be transmitted electronically and have had no instances of tampering." He went on to say, "We believe that the electronic prescribing process greatly improves security for the prescribing of all prescriptions in comparison to today's written and oral processes for prescription information." Now, this is from some time ago. Is it still valid that you can assert that the SureScript system has not been hacked and tampered with, and that you're confident in its integrity?
It's absolutely valid. It's valid. It was valid then, it's valid today, and we've been working on this very issue for several years, and it will maintain to be valid in the future.
So your answer to the question of what do you tell DEA is, get off the dime and use us.
Absolutely.
Mr. Miller?
I think our answer to DEA would be very similar to Mr. Hutchinson's answer, right? There is no single solution. You need to do something. Any electronic e-prescribing methodology is going to be more secure than the paper-based system that we see today.
Repeat that.
Any based will be more secure than what we have today. As I said
Can I ask
before,
you to repeat that just one more time for effect?
Sure. Any e-prescribe based system will be more secure than the paper-based system that is currently used today.
Okay, thank you.
It is more trackable, it is more secure, it is definitely used in other industries. Again, if this was the leading edge thing and no one had ever even thought of doing electronic transactions over the internet, then perhaps it would be, we need to do a pilot and kind of try, maybe spend 3 years figuring it out. But we all trade on the internet, we all do banking on the internet, I guarantee you your health records are going back and forth on the internet now anyway, even if you're not e-prescribing. So the first answer is really move forward with something. The second thing, though, that is really important is, in reality, many of the doctors that you're talking about are not sophisticated computer users. And if you pick a system that is difficult for them to implement, they won't. The doctors that I know are much more interested in patient care than they are about the latest version of Windows. And so you need to find methodologies and systems that are more simple. And does that mean that it may be a little less secure? Possibly. But again, it is definitely more secure than the current paper-based system that we have today.
Now, you say this from the position of also being a Department of Justice vendor, are you not?
Yes. So Covisint also provides electronic identity transaction for a law enforcement sharing program that basically allows the information related to terrorist activity to be shared both with federal and local law enforcement. That today is done...
That's fairly highly classified stuff that you don't want people floating in and out of.
It is definitely highly secure stuff that you don't want people to be able to access. That information is being transmitted today in a secure manner.
Without PKI technology.
Without PKI technology. As a matter of fact, the authentication mechanism used by the FBI in their system is also currently without PKI technology, although moving to it. So there are cases where the utilization of other security technologies certainly work. Again, banking, law enforcement. Is it possible that somebody can use this to perhaps find a way to get around the system? Yes, anything is possible. But again, if you look at the system we have today, which is little pieces of paper that are transmitted back and forth, it certainly is more secure to be able to do it in an encrypted and tracked technology. And I think that's really the big deal. In electronic communication, I can watch all that happens. And people who are watched have a tendency to not want to break the law. It's a lot easier if you're not watched.
And you can also, because the electronic information can be easily, cheaply, quickly, and effectively aggregated, you can very quickly detect patterns that are inconsistent with customary use and might indicate something is wrong so that you can make a proactive inquiry, correct? I mean, you can set up flags that go up at various times.
And that's absolutely true. Not only can you track very large patterns that you couldn't do, so you can take a look at a doctor who consistently is overprescribing a medication over years of time. You also have the ability to set up real-time flags. So, for example, if some sort of bad guy is going to steal OxyContin, he's not going to steal 11 tablets. He's going to steal 1 million of them. Well, no doctor prescribes 1 million tablets. I mean, you would see that immediately. It would be very easy for you to be able to identify the event that occurred and actually, in many cases, stop the event before the transaction's completed. I mean, that's how fast the electronic capability is.
And imagine just the value of taking the prescription out of the patient's hands and being between the two providers, between the physician and the pharmacist, to avoid that kind of opportunity for fraud.
Mr. Miller, my question for you has to do with the data gathering and the sort of public health aspect of it. I guess beyond what we talked about earlier, do you see public health value from being able to sort of track, ultimately even around the country, where a prescription for a particular type of drug is, for instance, suddenly ballooning, or where associations can be developed between a particular drug and then a condition that may emerge weeks later after the use? Is there public health value here to this, and how would you quantify?
Absolutely. So if you take a look at a parallel effort, which is really the ability to do electronic health records, right? Those electronic health records, along with a robust e-prescribing program, would allow you to see certain drug interactions, not only with other drugs, but drug interactions in general with patients that you may not have seen before. So not only do you see that OxyContin is being prescribed, but what you do see is you see the number of hospital visits, for example, that occur, right? You can only do that if you can marry those two electronic transactions together as opposed to paper-based. The other thing...
If you had to do it with paper, you'd
employ a lot of people, I suppose.
At vast expense.
The other thing that is interesting, and it's an interesting parallel, is that what we're seeing in healthcare in general is the old days of me going to the same physician all the time, where, to be honest, the reason why there weren't drug interactions and he knew what I was taking is he's the only person who ever prescribed me anything. And by the way, probably going to the same pharmacist down the road. Those days are gone. They're either gone because you travel so much that you go lots of places, or more tragically, that you don't have health insurance, and so what you do is you go to free clinics and you go to the ER, where, to be honest, that doctor basically has absolutely no idea what you have been doing or haven't been doing.
Or you're chronically ill and have 5 or 6 specialists all working on you.
Or you're chronically ill and you have 5 or 6 specialists. And those things are the things, really, that electronic prescribing allows you to be able to, allows the doctor to be able to understand all the prescriptions that you are currently taking. So I actually have a personal experience where my mother went into the hospital last summer, and she couldn't remember whether or not she had filled her prescription for her heart medication. And the ER doc said, I need to know, because if you have filled it and taken it, I can't give you this drug. And if you haven't, then I need to give you this drug. Well, she couldn't remember. And without electronic prescriptions, there really was no way to tell. It was kind of more of a crapshoot. And so those are, I think, some of the things that are just really important with that.